Vivian McGuire is paying around, was laid off, is paying around $2,000 a month for insurance, trying to maintain insurance, was laid off recently. Vivian, why don't you just explain what it's like to try to pay a $2,000 a month health care bill after being laid off?
All my savings are being depleted. My husband and I have worked many years. My husband's now disabled, and we can't change health insurances because of pre-existing conditions. If I could stay within the same company and lower my plan, which will save me just a few dollars a month, not very much, but it'll come out on the other end in paying higher co-pays and having less coverage. We are struggling right now to figure out how we're going to fill our oil tank for the winter for heat. I'm getting $101 a week from unemployment. It doesn't even put enough food on the table unless we start eating just spaghetti. We are cutting corners in every way we know how, and we don't know what to do anymore. We've put into the system and put into the system, and now when it comes time that we need help, there is none, while people at AIG go out for, on our dollar, our tax dollar, go away for luxury weekends. It is not fair. It is not fair that people work so hard for all their lives. I'm 59. It's not easy to get a job. Like you said, they look at me and say, her age, higher health care costs.
I share your outrage at what has gone on with Wall Street. It is wrong. And AIG just added insult to injury. It was an example of the kind of disconnect that there exists in this country when you have a growing gap between rich and poor and the middle class being squeezed out, falling through the cracks, because there are so many people who've worked all their lives, done the right things, and are now finding themselves like you, needing a hand up to get through really tough times, and choices, proposals are made to bail out and invest $700 billion to help Wall Street, or AIG gets a loan for $85 billion, and then they send their people off on pheasant hunts and spa vacations. When you can't put food on your table and afford your health care, there's this fundamental disconnect between what is going on in the real world and what's going on often, and certainly in Wall Street, and to some extent in Washington. And we need to make sure that what we're doing is helping you. It may be necessary to help the financial system, but we need to help you.